Malignant tumors in the head and neck region are often treated by surgical removal. The goal is to remove the tumor completely with a small margin of healthy tissue to reduce the risk of recurrence. Sometimes cancer surgery results in a defect which needs to be reconstructed on the spot, leading to non-optimal results. New technology that assists the surgeon is necessary to obtain better results. In my team, we developed this by combining the knowledge of scientists and working together. To obtain a tumor-free margin, we have developed fluorescence tracers that can show the surgeon in the operating room when the margin is not adequate. With 3D technology, we can pre-plan the reconstruction that fits precisely in the defect of a jaw. I want to develop methods of optimal reconstruction of a defect using 3D planning technology and use fluorescence so that surgeons can remove a tumor with a sufficient margin, both leading to better chances of survival for the patient. My name is Witjes and I'm an oral and maxillofacial surgeon specialized in head and neck oncology.